Hello everyone, welcome to Nursetra. Today we will discuss OSSSC Nursing Officer previous year question which is already held in 19 March 2023, and we will discuss today only nursing part. And let's see the first question for today. The first question for today is, what should be the temperature of delivery room to maintain warmth for neonates? Option A is 21 to 24 degrees Celsius. Option B is 25 to 28 degrees Celsius, and option C is 28 to 30 degrees Celsius, and option D is above 30 degree. Here the correct answer is option B, 25 to 28 degrees Celsius, because WHO recommended this is the temperature of delivery room to maintain warmth for the neonates, and others are incorrect. Next question, which among the following is correct regarding iron supplementation? Option A is take it along with milk, B is take it along with lemon juice, C is take it along with water, D is take it after having food. Regarding iron supplementation, which one is the correct? And here the correct answer is option B, because if we are taking iron supplementation with lemon juice, because lemon juice having vitamin C, rich in vitamin C, which is significantly boost the body ability to absorb iron. So the correct answer is option B, and other option other option is incorrect. Take it along with milk. If you will take iron supplementation with milk, it will decrease this absorption. Option C, take it along with water. There is no significant role. We will take iron tablet with water. Option D is take it after having food. Again, if we will take iron tablet with after having food, that also decrease the absorption. So the correct answer option is option B, take it along with the lemon juice. Okay. Next question, nurse is about to catheterize bladder of a pregnant lady. She should be aware that all the following facts about female urethra are true except. Option A, it is about 1.5 inches in length. Option B, it posterior to vaginal orifice. Option C, it passes through urogenital diaphragm. Option D, it is straight and offers minor resistance for catheterization. So which one is the incorrect? We have to find. Okay. So first one is, it is about 1.5 inches in length. Yes, it is about 1.5 inches in length, and in centimeter it is 4 centimeter. Option A is correct. Option B, it's posterior to vaginal orifice. No, it's not posterior to vaginal orifice. Urethra is anterior to the vaginal orifice. So option B is incorrect. Option C, it pierces through urogenital diaphragm. Yes, it is pierces through urogenital diaphragm. It is correct. Option D, it is straight and offer minor resistance for catheterization. Yes, it of course. So according to our question, the correct answer is option B. It is posterior to vaginal orifice. No, it is anterior to the vaginal orifice. Then next question. A 55-year-old male patient who is diagnosed with an evolving myocardial infarction insists on going home. The nurse encourages the patient to be admitted because the greatest risk within first 24 hours of sustaining an MI is option A, heart failure, option B, sudden death, option C, pulmonary embolism, option D, ventricular aneurysm. The correct answer is option B, sudden death, because patient having MI and within 24 hours we are telling that, that this is a golden hour, because there is a chance greatest risk patient having ventricular arrhythmia like VFib, ventricular fibrillation, and this is the most common cause of death within 24 hours of onset of MI. So answer is the B. Other option is incorrect. Heart failure, pulmonary embolism, ventricular aneurysm, this is not correlated with MI. So option is a sudden death, that is due to ventricular arrhythmia, ventricular fibrillation. And this topic like ECG and arrhythmias is the important topic. We will discuss clearly about this topic again another in video. Okay, let's another question. We will see first most common site of extrathoracic TB in children. Option A, lymph node, B is skeleton, C central nervous system, D is heart. Option A is lymph node. Yes, option A is lymph node is the correct answer, because in children The most common cause of common site of extrathoracic TB is tubercular lymphadenitis. This is occurred matlab this is due to the involve of lymph nodes. So the answer will be the lymph nodes, not other answer like skeleton, central nervous system and heart. We are eliminating other option and we will choose lymph node. Option A is the correct answer. Okay, next question. Which of the following condition is manifested by increased intraocular pressure? Oh, option A is cataract, B is conjunctivitis, C is dacryocystitis, D is glaucoma. Here the correct answer is glaucoma, because glaucoma is the condition where the intraocular pressure is increased and that lead to blindness. Okay, and the other option, why not other option is correct? Cataract is the condition where patient losing opacity of the lenses, and B, it is the conjunctivitis, it is infection and inflammation of the conjunctiva, and D is the dacryocystitis, it is the infection and inflammation of the lacrimal sac. It is not increase, these are not increase the intraocular pressure with except glaucoma. So glaucoma is the correct answer for this question. Okay, next, a client is admitted to the psychiatric unit of a local hospital with chronic undifferentiated schizophrenia. During the next several days, the client is seen laughing, yelling and talking to herself. This behavior is characteristics of patient having schizophrenia, and during next several days patient having this symptom like laughing, yelling and talking. The option is A, delusion, C, illusion, B is looseness of association, and D is hallucination. Here the correct answer is hallucination, because hallucination is false sensory perception without stimuli, and patient having schizophrenia, this is the common symptoms. Patient having hallucination, there are different types of hallucination is there: auditory hallucination, visual hallucination and else. So we will discuss later. And why in this question, why other option is not correct? Because A is delusion is a false belief, false fixed belief, and B is looseness of association. Here looseness of association means there is disorganized piece patient is having, and the C is illusion. In illusion, patient having misinterpretation with real stimuli, and many students having confusion between illusion, delusion and hallucination. I am clearing here, just listen carefully. Hallucination is the false sensory perception without stimuli. Okay, and if I will give example for the hallucination, that you are standing alone and you are seeing that in front of you another tall and long person is standing, and after some time he or she point. So you are telling this one ki someone came and someone went, and he or she is like that you are telling their characteristics and all. This is the example of hallucination. Come to the illusion. What is illusion? Illusion is the misinterpretation with real stimuli. Means you have some stimulus, like you have some object, and object actually really the object is water, but you are misinterpreting that one and you are telling this is snakes. Okay, so this is the example of illusion. And delusion, this is the false belief, not perception, this is the beliefs. Okay, this is the common difference between hallucination, illusion and delusion. Okay, so we'll go to the next question. For this question, answer is D. Okay, a client is experiencing anxiety attack, the most appropriate nursing intervention should include: A is turning on the television, B is leaving the client alone, C is staying with the client and speaking in short sentence, D is ask the client to play with other client. We have to see the patient condition. Patient having acute anxiety attack. During anxiety attack, as a nurse, what are the roles? The first one is option turning on the television. If you will turn on the television, then anxiety attack will be worsen, because will turn on the television, the stimuli will be increases and it will worsen the anxiety attack. So option A is incorrect only. Then option B, leaving the client alone. patient having anxiety attack, matlab patient having some problem. During that situation, we cannot leave the patient alone. So option B also correct. Incorrect. Option C, staying with the client and speaking in short sentence. Yes, if patient having anxiety attack, we have to calm down the patient by using our therapeutic communication, and during that time we have to access the what are the causes of acute anxiety attack, and we have to uh, stay with the patient only. So option C is correct. Option D, ask the client to play with other client. During anxiety attack, we cannot able to involve patient to other client for the playing activity. So option D is incorrect. So here the option C is correct answer. Next question. Uh, paracetamol is an